Hi, everybody. My name is Dr. Scott Giacomucci. I'm the director and founder of the Phoenix Center for Experiential Trauma Therapy, which is located in Media, Pennsylvania. Today, I wanted to talk about why complex PTSD is often misdiagnosed as regular PTSD. So, in order to talk about this topic, we need to consider some of the differences between classical PTSD and CPTSD, or complex PTSD. So classical PTSD was a diagnosis that was recognized in 1980 by the DSM-3, which is the book of all the mental health diagnoses. And essentially, classical PTSD was created by studying adults that had experienced single event traumas, usually veterans from various wars or railway workers that had experienced trauma on the railways. And from this observation and understanding of how trauma impacts adults, the diagnosis of post-traumatic stress disorder was created. Now, later on, many people, particularly Judith Herman, in her book Trauma and Recovery, started to argue that the classical PTSD diagnosis didn't fully articulate how complex trauma, reoccurring experiences of trauma throughout the lifespan, especially in childhood, really manifest in different ways than classical PTSD. And so this new diagnosis was proposed for CPTSD, or complex PTSD. So many people with CPTSD are walking around with the wrong diagnosis, and let's explore a little bit of why. So one of the biggest reasons why this is politics, really. That complex PTSD was rejected by the DSM-5 10 years ago, and again was not included in the DSM-5 text revision just a couple years ago. So complex PTSD is a diagnosis that was recognized by the World Health Organization in their International Classification of Disorders, the 11th edition, but it was not recognized by the DSM-5. And so this leaves it in kind of a limbo, kind of a purgatory, in that it's recognized internationally, but not as recognized in the United States, where the DSM-5 is primarily used. So this means that most insurance companies will not reimburse for sessions when the diagnosis is CPTSD. Now, the good news is that there's actually a lot of overlap between the symptoms of PTSD and the symptoms of complex PTSD. And actually, complex PTSD was created as an add-on diagnosis for classical PTSD. So the core symptoms of complex PTSD are actually the same core symptoms of regular PTSD. There just were some additional symptoms added to create complex PTSD as an add-on for regular PTSD. So the regular PTSD symptoms are re-experiencing the trauma and intrusions, such as flashbacks or nightmares, arousal and reactivity. This is the hypervigilance. This is the difficulty concentrating, the irritability, the loss of safety in our body, the avoidance and numbing behaviors, avoiding thinking about the trauma, avoiding talking about the trauma, doing whatever we can to dissociate and block out the feelings or memories related to the trauma. And then later, a new symptom cluster was added for regular PTSD, which is about negative beliefs and negative moods, blaming ourselves for the trauma or developing really distorted beliefs about other people or about the world because of the trauma we experienced. Now, added on to that for complex PTSD are 3 additional areas. Emotional dysregulation, really struggling to calm ourselves down when we get in touch with really difficult emotions, or just being completely numb and blocking out our emotions entirely. The second area is about difficulties with relationships, feeling like we really want to be in relationships, but really not feeling safe in relationships, or being really terrified of rejection or abandonment if we do get into a relationship. And the third area is about a distorted sense of ourselves, really feeling that we're worthless, or feeling like we're a failure, or that the world would just be better off without us. So these are the 3 add-on symptom clusters for complex PTSD. So many people argue that the regular PTSD diagnosis is really missing the complexity of how trauma impacts emotion and shame, and the ways that relational trauma really impacts us differently than shock trauma, like a natural disaster or a motor vehicle accident or other types of trauma that are not taking place within the context of a important relationship or attachment. And that the wounds that emerge from relational trauma are a bit different than other types of traumatic wounds because of the added complexities and the confusion of like someone that was supposed to nurture or protect us betraying us and harming us or abandoning us. Many people have also argued that the original PTSD diagnosis has too much of a short-term focus in terms of trauma, and that it's usually more oriented on a single incident rather than understanding the comprehensive history, the comprehensive complex history of trauma or adversity that an individual might experience throughout their entire lifespan. That usually the symptoms of traumatic stress are not traced back to a single incident, but that there's layers and layers and layers and layers of adversity that are all fueling what somebody's experiencing here and now. Another problem with CPTSD is that it's often misdiagnosed as borderline personality disorder, that there's a lot of overlaps between complex PTSD and borderline personality disorder. If you wanted to learn more about that, I created a whole video on it, which you can find on the channel here. Furthermore, CPTSD is often misdiagnosed as other diagnoses such as depression or anxiety or even ADHD. There's a lot of overlap between pretty much every mood disorder, anxiety disorders, and stress-related disorders with complex post-traumatic stress disorder. Now, there's a couple tips that I wanted to throw out there that I think would be helpful in order to avoid continuing to misdiagnose complex PTSD as regular PTSD. So one of the first and most obvious is to really consider developmental trauma and relational trauma and the history of an individual's experience throughout their entire lifespan. That even when the focus of someone's treatment goals might be about something that's happening right now, or might be about what they're experiencing right now, or might be about difficulties in their most recent relationship, we also want to be curious and ask about prior relationships and ask about early attachment figures and early childhood experiences. So the first tip is really to look earlier and look deeper. The second thing we really want to be looking for is this internalized shame that often accompanies complex PTSD. Of course, this is also something that's explicit with regular PTSD, but many times the shame, the feelings of worthlessness, the feelings of being a failure, the struggles with relationships that often result in more shame are really more characterized by complex PTSD than only classical PTSD. And so it's really important that we're finding the right diagnosis. And when we're working in systems that involve insurance companies, we might be really limited in that we might not be able to formally provide a CPTSD diagnosis. This is a problem that I run into in my practice and different agencies that I've worked in that we actually can't provide complex PTSD diagnosis because the insurance company won't pay for treatment if that's the diagnosis. And so we're usually forced to rely on the regular PTSD diagnosis. Regardless, I like to still educate my clients about the difference between regular PTSD and complex PTSD, and to really provide that psychoeducation, provide those assessments. The assessment I usually use is the ITQ, which is the International Trauma Questionnaire that was created specifically to assess for complex PTSD symptoms in addition to regular PTSD symptoms. When I talk to my clients about complex PTSD, pretty much all of them relate more so to the CPTSD diagnosis and the CPTSD symptoms and just the experience of complex trauma and CPTSD more so than regular post-traumatic stress disorder. I was surprised that when I really started introducing CPTSD to my clients that the overwhelming majority of them related to it more so than regular PTSD. And that it provides like a sense of validation that like this really articulates what I've been experiencing and what I'm experiencing now. And although diagnoses can be pathologizing and there's a real limitation to diagnoses, there's a real risk of over-identifying with the diagnosis and like making it a core part of your sense of self, which can become problematic. There's also a real validation in receiving the right diagnosis, in being able to understand the symptoms of a particular diagnosis and to see yourself, to see your present day experience in the description of that diagnosis and those symptoms. It helps us realize that maybe we're not crazy, or maybe what we're experiencing is somewhat normal for folks that have gone through the same things that we've gone through. And so there's a real validation and a real power, a normalization, almost a relief that can come by understanding complex PTSD or explaining it to your clients. So really invite you to share what you found helpful in this video and what it was like for you if you do relate to the symptoms of CPTSD, what it was like when you learned about CPTSD for the first time. Was it scary? Was it confusing? Was it really validating? Did it give you words to explain to others what you've been experiencing? Or do you notice that you or others really over-identify with this diagnosis of CPTSD in a way that has created other problems, perhaps, that has even further contributed to more shame or more what some people call a victim mentality or a sense of helplessness, feeling stuck with this diagnosis forever? So write in the comments what your experience of this has been. I do want to say that even though CPTSD and PTSD are big diagnoses, they're much more focused on what you're experiencing now as it relates to what happened to you in the past, rather than something being wrong with you. And there's always hope that I see people on a weekly basis heal and recover from both PTSD and complex PTSD, that it does not have to be a diagnosis that you're stuck with forever.